Good morning, deans, head of departments, and everyone who watch this video. My name is Hugh, and it is a shame that I can't present my mock lecture in a better place, so I present it in my room. And I know that my lecture is too small and the screen is too bright. You can't read the PPT, can't read the PPT, so I try to make my mock lecture clear. So the title today is the role of acupuncture in pain management. So, since we talk about pain, what is pain? In 1979, the International Association for the Study of Pain defined pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. So, there are some keywords in this definition that you should know. Unpleasant, sensory, emotional, actual or potential tissue damage. We can see that this definition tries to untie pain to actual tissue damage or stimulus, because pain is is very subjective, and it can be a psychological experience of the patient. It can be physical damage or psychological experience. So there are many kind of classification out there of pain. It can be classified by the factor that induce pain, for instance, thermal or mechanical or chemical stimulations, or it can be physical or psychological. And for the sake of for our clinical practice, we classify pain by its conditions. So the first one is acute pain, which is a pain no longer than 3 months. For instance, muscle sprain, joint sprain, and surgical pain. And acupuncture really has some advantage on this problem. The second one is chronic pain, which is usually longer than 3 months. For instance, degeneration or some chronic muscle strain. The third one is refractory pain, which has a high recurrent rate and hard to relieve. For instance, the typical refractory pain is trigeminal neuralgia, postherpetic neuralgia, and some lumbar disc protrusion. This is kind of hard. And the next one is cancerous pain, which is quite serious. Is a pain induced by metastatic tumor or the late stage of cancers. So the next one, another one is others. For instance, visceral pain, angina pectoris. This is some pain. This example of the others pain. So the fact is, acupuncture is really good at relieving pain. It has its superiority, but we have to admit that it also has its limitation. And as an acupuncturist or TCM doctors, you should know your advantage and disadvantage. So this is the analgesic effect of acupuncture on descending order. So the top one is the strongest and the lower one is the weakest. This is just a simple picture to let you have some concept. So the first one is neuritis and injury of locomotor system, for instance neck pain and muscle sprain. And acupuncture really have some advantages on this problem, and you should know that. and the third one is headache, and fourth one is visceral pain, autonomic nerve dysfunctions, and cancerous pain. And you can see that the acupuncture effect, acupuncture analgesic effect is getting weaker and weaker. So we already know the stimulus, the classification of pain, and now let's talk about the mechanism of pain. So there are two mechanisms of pain: the peripheral mechanism and the central nerve mechanism. So this tells us how the pain or the stimulus outside our body, stimulus outside our body act on our body, and how our body react to those stimulus and send those signals to our central nervous systems. So the first one, so here the stimulus outside, it can be chemical, thermal, or some other stimulus, and it activate a special nerve cell, we call it nociceptor. So this nociceptor distribute throughout our body, and they respond to different kind of stimulus based on their location. So when this stimulus activate nociceptor cell, this nociceptor cell release some neurotransmitter, for instance, different, for instance, 5-HT, histamine, P substance, and cytokine. And this neurotransmitter will be transmitted through our C nerve fiber or A beta nerve fiber through our central nervous system, which is in our spinal cord and our cerebral cortex. So this is the a picture of central nervous system. So we have this ascending pathway, descending pathway, and this signal is go through ascending pathway to our hypothalamus and our cerebral cortex, and our brain will integrate and process these signals, stimulus signals, and giving feedback to, through the descending pathway and to our body, and you feel pain, and you will also give your feedback what to react to this stimulus. So we already know the mechanism of pain, and today in 21st century, as a TCM doctor, well, when you got a patient come up to you and ask, yeah, the acupuncture, the needle is very good in relieving my pain, but how can a needle relieve my pain? Can you tell me? So you explain